Welcome to the Inspired Society interview series where I interview people who inspire me. And today I'm over the moon to announce that my first interview ever is with my beloved father, Dr. Ross Walker. So thank you for joining me, Dad.
My pleasure, darling.
And so the first question I wanted to ask is, can you tell me what inspired you to become a doctor?
Well, actually strange. It probably started when I was about 7 or 8, where my mother bought me a book on the atom. And so I started reading this book and I was just fascinated by the science of it. So from the age of about 7 or 8, science fascinated me. I had a little chemistry set down in the garage and used to mix things, and it just, to me, science was wonderful. And so all through my early teenage years, I wanted to be a chemical engineer because I found chemistry fascinating. But then I thought I could probably do more than that. And just about age 15, 16, I thought I'd like to be a doctor. So my mother, inspirational at times though she wasn't, said to me, "Oh, you're too lazy to be a doctor. Why don't you just become a maths teacher? You're good at maths." So
Did she really say
she
that?
said that, yeah. So that's a red flag to a bull. So I put my head down.
Maybe she was knowing exactly what to say.
She could have.
It was reverse psychology.
Dearly departed mother. So she could have done that, and I got into medicine, and it was just the rest is history from there.
And do you love it?
Oh, it's magnificent. It's to me, people talk about retiring, but I couldn't imagine. It's my hobby. It's all encompassing to me. It still fascinates me. I've been a doctor for over 30 years, and it just fascinates me. Everything about it, every aspect of it. To me, it's the perfect job. Not only can you help people at a one-to-one level, you've then got to go to beyond that, the subconscious interaction with the human being, and then all the while you're seeing a patient, you're also thinking of the science behind it, the diagnostic process, the therapeutic process, what investigations. So the medical side of my life, which is only one part of it, is still fascinating to me. But I've been very privileged not just to have the medical side of my working life, but I'm also a professional speaker, so I've had experience to speak to 35,000 people in a cricket stadium in Mumbai, in India twice. I've spoken to 12,000 people, and you were in the audience in New Orleans. That was
amazing.
That was an extraordinary experience. And so as a professional speaker, that's been wonderful. I've been on the Australian media and occasionally on the American media for the past 20 years.
And that's what I wanted to ask about that, because you're not just a doctor. You don't just see patients.
I have my own radio show. That's a real plug. Healthy Living on a Sunday night on TUE 954 on your AM listening dial.
Oh yeah, yes. We've heard that one.
Yes.
So what inspired you to spread the message beyond the patient contact?
Okay, well, firstly, what disturbs me about the way medicine's practiced is we have the ambulance parked at the bottom of the cliff waiting for people to fall off. So instead of fixing the rails at the top of the cliff, what we do in medicine is build faster ambulances. And so really, to me, the best treatment of heart disease, which is obviously my area, the best treatment of cancer, the best treatment of all modern diseases is not to get them in the first place. It's called prevention. And interestingly, I cottoned onto this in my 20s when I was training as a cardiologist. I'd see people coming back to the hospital for their second bypass operation. We're talking about somebody coming at your chest with a chainsaw, not once, but twice. And Albert Einstein once said there's nothing that's a more certain sign of insanity than to do the same thing over and over again and expect a different result. And so people would come in, have their chest split open, have their arteries bypassed, and just go back to the same life. And nothing would change. So within a few years, their arteries have reblocked, so they're back for another go at it. And I thought, this is madness. There's got to be a better way. So over the last 30 years, I've developed what I believe to be a very, very effective preventative program. And I see the results in my practice all the time. I see the results in my talks, in my radio shows, in my books. And to me, that's what it's all about. It's about spreading the preventative message. And when you do it one-to-one as a doctor-patient, it's effective, but it's only one person.
Yeah.
But when you do it to 20, 30, 40,000 people listening to a radio show, or an audience of 1,000 or 10,000 people, you're spreading a much more far-reaching message, which I think is vitally important.
And also, I'd like to talk about the person who has encouraged you and allowed you to do all this amazing work.
You're a wonderful mother.
My mother.
Jeez.
So interestingly, I also asked her to come on for an interview because I wanted to start the interview series with my mother and father, because obviously the conversation of the mother and the supporting role to your work at home is just as vital and important as all the work that you've done.
Oh, look,
And she hesitated. She was reluctant to be interviewed, so you can be interviewed in her place. How important has her role been in all the work that you've done?
Vital. Couldn't exist without it. We're talking about a human being I think is the most extraordinary person on the planet, and I've had the privilege of being with your mother for nearly 40 years. She's just, she's not just physically beautiful, she's just, every level of her being is beautiful, and all she thinks about is a family. It's what can I do for my husband, my children, my grandchildren. She continues to astound me after 40 years.
Because it's an important conversation. I think oftentimes we do see people in the media and we don't really see the support team or the people that love them behind them, and often people who are successful.
The powerhouse behind
the powerhouse behind But people who are successful generally do have a powerhouse behind them. I think it's important to acknowledge.
Yeah, I don't think anyone should see themselves as that important. I don't think if you're in a prominent position, you shouldn't say, gee, aren't I wonderful? I'm not wonderful. I've got all these wonderful people around me. I've been given a few skills which I've had the privilege to use.
Well, every contribution I think is valid. Every contribution is equally important.
Absolutely.
We're just holding different space. So just to finish up, could you give some tips for living a mindful and conscious life?
Well, I think firstly that I always talk about the 5 keys of being healthy, and I think that's part of this. So it's important firstly to talk about those, and I'll summarise them briefly. Number 1, you cannot be healthy and have any addictions. So you can't be healthy and smoke, you can't be healthy and drink too much grog, you can't be healthy and snort cocaine. So you can't be healthy and even use legal addictive substances. So for example, if you enjoy a couple of cups of coffee a day, that's fine, but 5 or 6 are not. Having 4 or 5 cans of soft drink a day is not good for you. So get rid of your addictions, whatever they may be. Food's an addiction. So get rid of your addictions. We all have to eat, but we don't have to overeat, which is a major problem in modern society. Number 2, and people don't talk about this enough, but cultivate every day of your life a good quality sleep habit. Now, for young mothers like yourself, that doesn't always work out because there are children involved, but I think all of us need to really develop very good sleep habits, which is something I talk about all the time. Number 3, good quality eating and less of it. Now, just recently I was all over the media because of this big study that came out of this shonky little place in the UK called Cambridge University, one of the greatest universities in the world, where they looked at 600,000 people and there were 72 different studies of diet, and showed that there was no relationship between meat, eggs and dairy and heart disease. Now, I've been saying this for 15 years. I wrote about it in a few of my books. So so what I'm saying to people, the message with nutrition is very simple. It's called eat less and eat more naturally. Number 4, which is what I call the second best drug on the planet, is a thing called 3 to 5 hours every week of exercise. It's exercise that tests you. And number 5 is the best drug on the planet, which is now getting to your question, which is a thing called happiness, peace and contentment. So the more happy you are with your life, the more contented you feel, the more peaceful you feel every day of your life, the healthier you are. And what do we all want in life? We want to live long and live well. And I think that's the problem. Many people are living well beyond their use-by date, which is about 30 to 40. We were only physiologically designed to wander around a jungle for that time and have our head ripped off by a saber-toothed tiger or die of some infection, not with double our use-by date. So when you get, it's not. So when you get beyond 40 in this modern society, parts of the body don't work as well, the metabolism slows down. So it's really important to maintain all of those good quality life habits, and sometimes take appropriate supplements and sometimes take therapeutic drugs when they're appropriate to keep your body healthy. But I think the things that you've been talking about for a long time, and I totally agree, and I wrote about it extensively in my last book, is to really live from the top down, not from the bottom up. And I think so many people live from the bottom up. Oh, I've got a cholesterol problem, I take a pill. But I think really you should see your life symbolically. No matter what happens, whether it's good or bad, saying, well, what is the universe trying to teach me here? And live from that place. And go into every situation you're in, I choose peace over this. I'm not going to give you the power to cause my heart attack. And also to develop the how may I serve attitude rather than what's in it for me. And those simple principles, and we could talk for hours about all of this, things like meditation. I've been meditating every day for the last 20 years and I couldn't imagine a life without meditation. But there are so many aspects to living a conscious life. But part of those is you have to be healthy and your mind has to be healthy to live that life well.
Well, thank you very much. It's been an amazing first interview on this series and I look forward to many more.
Thank you, darling.
Thank you.